of restlessness from Nash Therapeutics, and I hope those who are going through the different sessions of Nash Therapeutics and the excerpts are getting an idea about how easy it would be if we only keep our focus on the basics, and even without a repertory or a materia medica, we can prescribe beautifully, easily, and do this repeatedly in different cases. We have studied so far remedies such as polycrest, calcarea lycosulfur, mercurius, calcarea for silica, nux vomica pulsatilla, antimcrude moxol, and whatnot. And today is day 4 of Nash Therapeutics study streak. So we will study the trio of restlessness today, which is aconite, arsenic, and rust ox. And the reason to pick up these three remedies are that these three remedies are mentioned one after the other. First aconite, then arsenic, and then rust ox. That's the beauty of Nash Therapeutics, and we have already done the similar exercise in Alan's keynote study streak. Those who are new to join, Kalpa, Kalva Pravalika, Ismail, Homeo lovers. I don't know if everyone is online, but whoever is online and whoever is watching this later on, if you want to get access to, you know, something that is to be useful for your practice from clinical point of view, then I urge you all to go through Alan's keynote study stick where we took up remedies one after the other in relation to the previous remedy and not in a linear alphabetical fashion, which is the normal way that we study. We need to study materia medica in a relationship of the previous remedy or something that is a group of remedies. And that's what Nash does. And in the last three sessions, we covered Nash three around 15 remedies, one after the other, just like he has mentioned. And today we'll take up aconite, today we'll take up arsenic, and today we'll take up rust ox. These are the next three remedies in line with what Nash has mentioned in his book. No random theory, just what he has mentioned in relation to each of them in the book, in the physical copy, which he printed way back in 1900. We are taking up those gems of Nash and sharing some insights and what he has written from those books. So the first thing that he mentions is that there is this trio of restlessness which I wish to take up, that is aconite, arsenic, and rust ox. And all the three remedy are equally restless, yet also are very different. We all know that restlessness is a key feature of arsenic. We have been taught and brainwashed and I would say imbibed with this knowledge right from our time in our college, and we see the same thing in our clinical practice. But what is the challenge for each homeopath in clinical practice is that there is a challenge to understand the differences between the restlessness of all the three remedies and similarly all the other different remedies. That's where we should learn from these authors. So what does Nash say about the restlessness of aconite? And what you see is that he mentions something from herring again. In all the 15 remedies that we saw in the last three sessions of Nash, he mentioned some of the other ideas about how herring has been valuable in giving shape to his ideas. And again he quotes herring where he says that in aconite there is heat with thirst, hard, full and frequent pulse, anxious impatience, inappeasable, beside himself, tossing about with agony. Now, if you just dissect all these words individually, you will see that you will have a condition which has developed just few hours ago, which has you know, unbearable agony, and the complaint is so vast that the patient feels that he is going to die or he is going to suffer something really miserable. That is the intensity you need to understand and feel in your clinics. It is not something that is bound to be, interpretation, but something that is clinically easily seen. And that's what Nash says. And he mentions, going further, that in many of the fever cases, homeopathic doctors, this is in 1900 and this is purely applicable in 2024 also, many homeopathic doctors give aconite and belladonna in alternation. Aconite and belladonna in alternation in fevers. This is a totally useless concept. This is what Nash says, and I so much so agree. One remedy at a time is going to make a lot of difference if you know how to give, where to give. To this, I would say that we have recently undertaken a fever workshop, and all the attendees who are right now watching this, they want the fever workshop recordings. We'll be putting up soon, so you can access them whenever you wish to see whatever you wish to see and go through them. So, what does Nash say when to give aconite, when to give belladonna? And those who are on Instagram, you would be disappointed right now in this live session, but I'll put up the recording of my PowerPoint, which I'm right now sharing on YouTube side by side with my presentation, where I put up the differences of aconite and belladonna, exactly how Nash has mentioned in his book. So what does Nash mention? That aconite has dry, hot skin which does not have sweat, whereas belladonna has even greater surface area of heat, not in single spots. It can be a vast area, huge area, the entire trunk, head, hands, legs, somewhat like that is affected, and there is sweat on covered parts. Next thing, what for aconite Nash mentions is that he tosses about in agony. There is a kind of a restlessness, and he has an element of fear. The same thing what we see on the contrary in belladonna is that there is a kind of a semi-stuporous feeling. In fact, if you go in Allen and if you see, there is a word mentioned that there is sleepiness and sleeplessness in the same patient. In one line it is mentioned sleepy although cannot sleep. That's what is semi-stupor condition in acute states that we will come across. And what the Dr. Nash says, for belladonna in acute cases, along with semi-stupor condition, there will be twitches and jerks. So there will be kind of a movement of one part of the body which you will be able to notice. That is where you will be able to decide whether to give aconite or belladonna. The third thing what Nash says is that there is a, kind of a distress in the chest region or in the heart region for aconite. You have to understand this. Once you understand this, your ability to prescribe in acute condition will increase 200% and not just limit yourself to 5 or 10 cases. It's going to give you the confidence. That is what is required for each homeopath in the beginning of practice. I have been there right from the beginning of my practice, and I saw how we feel fearful to repeat the dose of medicine, to give high potencies, to differentiate medicines. These are all the loopholes where the homeopath can fall into, and don't get out of it, and get frustrated. So Nash says that there is this kind of distress in the heart and chest region for the aconite, whereas for belladonna it is everything is centered in the head. And once you understand this, the heat of the head, the patient is having all the conditions around the head, your ability to prescribe aconite or belladonna improves very well. And last but not the least, the differentiation what Nash gives for aconite and belladonna is that there is 3x fear in case of aconite, and there is very less delirium or it is totally absent, whereas in belladonna the delirium is present along with imaginary fears. someone is going to come, someone is going to happen. And that's why we next have tomorrow the trio of delirium remedies, belladonna, hyoscyamus, timonium, which I will undertake. So this is the basic differentiation what Nash gives for aconite and belladonna. Next is that he gives that aconite is equally valuable in all conditions of pain, and he mentions trio of pain, which is aconite itself, chamomilla, and coffea. And there will be a difference between all these three remedies he takes up in his different remedies, other remedies that he'll write about in future, that we will discuss as well. Chamomilla, coffea, how it is different. But to go back to the exact pain of aconite, it is the tingling and numbness and formication which will be there with the pain, that will differentiate aconite from the other remedies. Next is that aconite will be looking very similar to you all in complaints with rust ox. But what is different is that rust ox will have a kind of a dull aching with the numbness, whereas aconite will have a lot of fear. It can be distress, it can be agony, he will be restless with the pain, it will be numbness also, it will be tingling also. So the element of the mind will always be there for aconite. And two important modalities before closing what Nash says, he gives a lot of stories. I would urge the viewer to go through the different stories what Nash mentions. I cannot reproduce the entire stories, but I've just taken excerpts and brought out in front of you. If you have not read Nash, or it is a kind of a revision for you all, what he mentions is that there is a kind of a fright, element of fright, and there is a dry cold air. These two things are very vital for aconite to be prescribed. Once you find this, it's a winter season in India. Most of the people who are following this page are going to be right now experiencing winter in their clinics. You will be much more happier if in the first 6 hours you prescribe aconite and succeed. So he finishes aconite, and the next remedy which he undertakes is arsenic album. Now, arsenic album is one of the widely abused remedies. We all know everyone is using left, right, and center. But there are some beautiful things that Nash mentions in his book, and we should go through it, because even though we know about these remedies, we should go through these books, because you know the authors have put in their experience in the books. They have just not written any xyz materia medica. It's the philosophy that Nash mentions, it's the materia medica. He gives the experience of his use of arsenic. In fact, what you will see is that in the remedy arsenic, he has given how you can expect a follow up after giving arsenic remedy. I believe no, or very rarely, a materia medica will give you a follow up of what happens after arsenic is given. Go and read arsenic, you will get to know. But to summarize for you all, I want you all to just be with this small part where he gives a very beautiful explanation that arsenic patient is, aconite patient is actually restless in early stages of inflammation, but arsenic patient is restless in later stages of inflammation, and when the patient becomes lack or reduced in strength. You have to understand these finer words. And the idea is that the patient is vivacious, he takes care of his health. Now you'll read from other books and you will get to know कि arsenic is so much fastidious, he is so careful about his health. Yes, and he gets deteriorated, and then he comes a stage where he goes into total lack of strength or reduced strength. That's where the arsenic restlessness will come in, and that's what Nash mentions. He wants to be restless, but he does not have the strength. Can you understand this finer and subtle meaning? Once you understand this, what Nash mentions, he wants to be restless, but he does not have the strength. You will be able to give to all your patients with increased confidence the arsenic remedy and not abuse it in all the patients. So next, what he gives is arsenic. How will we the follow up of an arsenic patient. This Nash gives on page number 90 very well. I would urge everyone to go home after this video, go through the book Nash Therapeutics, Leaders in Homeopathic Therapeutics by Dr. E.B. Nash, and read on page number 90 what he has given about the follow up protocol. How will the patient improve? Going further, we have arsenic. Yes, Mahi 2004. Arsenic Alba is mentally restless but physically weak. That is what our latest books mention. But how will this stage comes? That is what is mentioned in Nash, and that is what I'm sharing. So next we have is burning of arsenic is very well known by all of us. And where will the burning of arsenic be seen? It will be seen in mostly acute diseases. Of course, you will see in chronic diseases, but chronic diseases, Nash says that he sees more often burning cases which are more or less suitable to be prescribed sulfur than in acute cases. And in acute cases, you can think of arsenic. Arsenic is ameliorated by heat, which is opposite of Cicalcor. Now, Cicalcor is a remedy which will have a part which is cold, which will also be burning, and yet he will not be required to cover it. And that's where these finer differences of arsenic and Cicalcor have been explained by Dr. Nash. Further, Dr. Nash mentions that the remedy acts on the gastrointestinal tract right from the lips to the entire anal mucosa, anal region, and you can definitely go and check out how beautifully he has described the burning in different parts, which is ameliorated by heat also. Next, he says that there is a trio of coryza which he wants everyone to look into. And what is interesting is that he gives an indication of arsenic in coryza. What is the indication? You have given a patient Merck Sol, patient does not improve. And now you are wondering what to give, what not to give. Give arsenic and the patient will improve. So that's what Nash mentions, that in the trio of coryza, arsenic album, allium cepa, and Merck Sol are the three remedies which he usually prescribes or differentiates and goes further. Next, you have is all the lung troubles, especially the pain in the acute apex of the right lung, upper third part. Arsenic can be indicated. He gives a couple of cases from his practice and someone else in the practice about how beautifully this remedy helped in certain cases of pneumonia and typhoid. Last but not the least, what summary I picked up from the Dr. Nash's Leaders in Homeopathic Therapeutics for arsenic is that there are three words which are important, and he mentions in the end. And he mentions it for the physical complaints, but I feel this applies to everything that arsenic shares. And those three words are out of proportion. What is out of proportion? The mental anxiety is out of proportion. The physical weakness is out of proportion. The subjective symptoms which he patient shares is out of proportion. The objective symptoms which we find by checking the patient is out of proportion. Mostly it is subjective, but everything is out of proportion. You will feel there is no problem. The patient is complaining so much. The patient is sharing so much. Why is he getting so much anxious? That's where that is out of proportion. Once you understand these three words, your prescription for arsenic will be judiciously employed in practice rather than abused left, right, and center like we all have been doing. So that closes arsenic album for us. And last but not the least, remedy. Actually, we have undertaken 5 remedies every day, but today we'll take only 3 remedies because they are group of 3 remedies which act beautifully well, and we need to differentiate in each case. How do we differentiate one from the other? So what we have is rush talks, the last remedy for trio of restlessness. There is an internal uneasiness with aching and soreness, which is better by movement. We all know about it. But this restlessness is what differentiates rust dogs from aconite and arsenic. Aconite has lot of restlessness, and with that there is a fear. He wants someone to be taken care of immediately, or else he will feel he will die. You will feel it, it will be palpable to you inside also. Arsenic album is, restless equally, but does not have the strength. The restlessness is of no use because he does not have the strength to do anything. Whereas Rustox has the strength, he will move about, he will go around and do something to make himself feel better. That is where you can differentiate. Next, he goes and tells that I gave an elaborate description of how arsenic is useful in typhoid. Similarly, he says that Rustox also equally competes with arsenic in all the cases of fevers and typhoids. In deliriums of fever, he compares with lot of remedies, especially where the patient answers and goes back to sleep. And what he gives is a valuable indication. Dr. Carol Dunham have used this remedy Rustox in all the cases of fever where the cough has been seen as a prodrome. There is an entire workshop of fevers which I have recently undertaken in the month of August and September. Those who wish to avail the recording can stay tuned. They will get the links of how they can access the recordings. But what Nash mentions right now, we are focusing on Nash. Rush talks acts mostly on the fibrous and the muscular tissues, tendons, ligaments, membranes of the joints, and the first motion aggregates. We all know about it. Last but not the least, Dr. Nash mentions that rust tox is not so frequently given in all the skin troubles, and we should judiciously use it in all the skin troubles, especially that are of vesicular type. If you are a good student of medicine, if you are a good student of pathology, you will know that every skin problem goes through different layers: macule, papule, pustule, vesicle. Once it reaches the level of vesicles, that is the phase where you can give Rustox. Now he mentions that all the other remedies, similar presentation of vesicular eruptions are there. Apis, Cantharis, Lachesis, Ailanthus. Go and differentiate. He mentions about them, their conditions, their presentations in different those remedies respectively. When we take up those remedies from Nash in future, I will definitely cover my part over it. But what he says that we should employ it more often in cases of skin troubles, eczema or vesicular type of eczema. And last but not the least, he has used the potency prepared by himself in his clinic for all the skin troubles. So we are all worried and we are all, uh, anxious. We ourselves become aconite and arsenic in cases of prescribing higher potencies. The reason is that you have not experimented. If you fear something, you will never jump or you will never be able to experiment. So you will have to start using higher potencies, 10 m, 50 mm, order them, give it one dose, wait and watch, see what happens. There is nothing which is untoward going to happen. If Nash was so confident of potency of Rustox to be used in all the cases of vesicular eruptions and skin troubles, why not us at this age where things are moving fast? Allopathic doctors are giving results in few hours. Why can't we also give the result in few hours? So that closes my talk today. I hope everyone who is glued till the end have been helped in some way or the other. My frequent and constant urge request to everyone is that go through the basic books, leaders in homeopathic therapeutics, Allen, Sporic, master them like your back of the hand. Once you know that, then go and take up another method. You will always come back to these methods which are tried, tested, and going to be helpful. Some other methods will depend on interpretation. The things that these authors have mentioned are not dependent on interpretation, they are what they are as it is. So we close up today's session and we'll meet tomorrow evening 5 p.m. with trio of delirium, which is belladonna, hyoscyamus, and stramonium. So stay tuned, and I hope this has helped anyone out there.